Michael Harrison, Saturdays at 1.
Gallbladder problems, gingivitis, a bad back, indigestion, fatigue, low libido, not sleeping well, need to lose weight. Just some of the topics you'll hear about. Hi, I'm Dr. Bob Martin. Join me Sunday mornings at 10 on Talk 1470 WNN.
Talk here. Talk there. Talk 1470 AM and 95.3 FM. The Health and Wealth Radio Network. WNN.
Times are tough, and right now those in the commercial world know that being heard via advertisements is the name of the game. AmpSquare.tv understands how important advertisement is and is proud to express that it's truly the only plugged-in internet television production company on the market. Amp2.tv live streams all their shows across all the major selling markets in the U.S. and abroad. Call them at 866-224-5422. The AmpSquare.tv library allows productions to be seen over and over again, making commercial platforms more usable. Call 866-224-5422. Toll free 866-224-5422. Amp2.tv, the first and only internet television network that's truly plugged in. 866-224-5422. That's AMP2.TV. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hi, welcome to You and Your Doctor, where we're teaching you how to live a longer and healthier life. I'm Lorene Anderson, your host for this evening, and I'd like to welcome you to our show this evening. We are on every Tuesday between the hours of 6 and 7 on 1470 AM and 95.3 FM. And we're also live streaming on YouTube at AMP2TV. And we are also on WWNNradio.com, You and Your Doctor. So I'd like to welcome you. Thank you for joining us this evening. Every Tuesday evening, we bring on the best doctors to help educate you and give you insight as to what is available out there, and also to help educate you in finding that right doctor for whatever your needs might be. We're being presented by AMP2 TV, and we're proudly sponsored by All County Healthcare, where patients are the heart of their business. It is a Medicare certified home health agency that can help you with all of your after hospital care, whether it happens to be skilled nursing or just help afterwards. So, CNA, Certified Nursing Assistants. So, welcome again, and we have got a wonderful group of doctors here tonight. Our first doctor is coming to us. He's board certified. He is, well, let me introduce you. So please, Dr. Fernando, please tell us what your fabulous specialty is.
Well, Lorena, I'm very happy to be here tonight. I'm a general surgeon who specializes in bariatric surgery, that is weight loss surgery, and I have also an interest, a specialty in robotic surgery.
Oh, I see. Isn't there a special name for the robotic surgery?
It's called Da Vinci. Da Vinci is the brand name for the robot that we use in general and thoracic and cardiovascular and gynecological surgery.
Okay.
So many people call them Da Vinci procedures.
Okay, and the Da Vinci procedure happens to be very state-of-the-art. Tell us a little bit about that particular therapy or machine that you use?
Well, it's an amazing advance in technology. It stems from studies and research that NASA did years ago, trying to develop a machine that would allow for more precise surgery on the astronauts or on the Army when people were far away. So we have a machine where the surgeon basically sits in a console and controls a laparoscope, a scope that is inserted to the patient for the procedure is attached to some robotic arms.
Wow.
We never did what was intended originally of you sitting home doing surgery in the hospital or something like that. But we did benefited from the advanced precision and the better imaging that we obtain with the robot.
Oh, that's incredible. That is absolutely incredible. And what I've heard also is that the incision is very, very tiny. It's much more precise, and the healing time is much faster.
Yeah, we have better healing times because we do, as you will say, less incisions. And when we do the actual surgery inside, since we're more precise, is less the damage that we cause on other tissues. We're very precise on just addressing what needs to be fixed.
Yes.
So that leads to better healing and sooner.
Wow. So you're a bariatric surgeon, but also a general surgeon as well.
Yeah.
Tell us a little bit about the bariatric surgeries that are in the news right now, some of the state of the art and some of the things that aren't working very well.
Yeah, well, there in bariatric surgery over the last 10, 15 years, there has been many advances. Some advances have not worked out that well as anything in medicine. So, but there are many things now that we know that work for the patient.
Okay.
The things we do the most nowadays is a surgery that is very simple. It's called the sleeve gastrectomy. And it's a surgery where we basically make the stomach smaller. It's very simple. We just cut away a piece of the stomach, make it smaller, and it helps the patient in two ways. By giving them a smaller stomach, limits the amount of food that they can eat at a time. But we also know now that when we remove the part of the stomach that we remove, that piece produces the hormones that makes you hungry, that makes you want to eat. So we affect two changes. It controls the size of your amounts, but it also controls your hunger, your desire to eat. So that's why it's so effective. Because at the end of the day, being overweight is a disease of your ability to control the amounts that you can eat.
Right.
So even though, as we were talking earlier today, the treatment of obesity has a lot to do with the emotional component, but by doing this, we give you tools that helps you be able to control your intake and your weight.
Gotcha.
In addition to that, still basically one of the standard surgeries that can be done is the gastric bypass, which nowadays is way more safe than what it was 20 years ago. Basically, the chances of you having a significant complication in a gastric bypass are as high of the chances of you having a complication, having a hernia or a gallbladder or any other kind of surgery, not worse than that.
Okay.
And both
Great.
the gastric sleeve and the gastric bypass we can do with the robot. So it's
you
even
can. You
more
can use the
precise.
Da Vinci
we do
technology.
them with the Da Vinci.
Wow, that's excellent. Because that I would imagine that allows the healing to happen so much faster.
Yeah, the patients basically spend one night at the most two in the hospital. They go home and they're back to regular activity in 7 to 10 days.
Oh my goodness.
Now, nowadays it's also pretty well established that we were not sure 10, 15 years ago, but it's pretty well accepted that in the treatment of diabetes type 2, if you are overweight, both surgeries, most significantly the gastric bypass, but the gastric sleeve is very good on that. They basically, you can cure diabetes type 2 if you are overweight and have surgery.
Really?
By hormonal changes that occurs due to the surgery and by the fact that you lose weight, we can obtain in the gastric bypass, if you have been diabetic for less than 10 years, you have a chance of about 90%. 90%. That's better than many other conditions
That's
of getting not better, of getting cured of the diabetes going away, and you're not being diabetic anymore or needing medications.
That is absolutely amazing. When something you said something very, very important, and that is that overweight, obesity is a disease.
Yes.
Okay, because it's right along with the addiction. So, many times, you either have the alcohol, the drug, the eating, the sex, the drama, all those are addictions. So, you're absolutely right. When you take a look at someone who has an eating disorder, you have to take a look at the addiction. You have to take a look at the emotional component to it and the psychological component as well.
Yes.
Because I have heard of some people that, so they go through all of the procedures and everything, and they're losing weight. However, their psychological state is not in congruence with their physical state. So what do you do to acknowledge that, to help them with that?
Well, we do believe, and I do believe that the treatment of obesity is not simple. It's a very complicated disease.
Mm-hmm.
And one of the things that we, the medical world, have done to underserve the obese patients is not give them the importance that it requires, and treating it as a disease.
It is a disease,
And
yes.
like any disease, it requires a multi-pronged approach.
Mm-hmm.
If it was simple, you would do the grapefruit diet, and everybody would be happy with the grapefruit diet. And lose weight.
Exactly, yes.
But it's not like that. So we need to work with the physical component.
Right.
We need to work with the emotional component. And we do this in many ways. We do support groups where patients with the same problems can get together and talk about their conditions and their own solutions that they have to. We work under a policy of 24-hour access. So it would be incredible for me to describe the amount of time I spend talking to my patients and not dealing with the medical or the physical part, but dealing with their emotional components of
Yes.
how to handle the stress of being obese and of having the surgery and adapting to the new changes. And also, it is mandatory in our center, as part of our protocol, to have the patients have a full psychological evaluation prior to surgery. And contrary to what people believe, we cancel patients. We don't do surgeries in patients that we don't think that are emotionally fit to have the surgery.
Wow.
And
That's
after
that's wonderful.
And after the surgery, I encourage my patients that do the best are the ones that keep going to the psychologist
Yes.
for continuous
For post.
Yeah.
Yes. Yes, because something, they didn't get overweight overnight.
Yeah.
And there's certain issues, it's kind of, it's not what you're eating, it's what's eating you.
Yeah, but it's a disease, and we need to accept the fact that it's a deadly disease.
Yes,
actually,
it is.
We know by studies that people who are morbidly obese will have an early death, will last 12 to 15 years less than their friends and peers that are at a healthy weight. So it's a deadly disease, and we need to see it like that and address it like that.
Wow. Well, that's wonderful. I'm thrilled to hear that. Something, please let our audience know how they can get a hold of you.
Well, the easiest way is to call my office, 954-472-1322. And if they get in contact with my staff, I'll be happy to see them personally. We do also group consults for bariatric, so patients can schedule a group consult, or they can see me individually, however they prefer. They can also access the website for the hospital. I believe it's fmc.com.
Okay.
I don't remember the website. We can find that out later. But the easiest way really is by calling my office by phone, 954-472-1322.
Okay, and where are you located?
I'm located at West Oakland Park in Sunrise, 8395 West Oakland Park, Suite F, that is very close, about 3 blocks from Florida Medical Center.
Okay, I was going to say, because I'm familiar with Florida Medical Center.
Well, as a gift to our patients and to me, as of next month, we're actually moving on campus at Florida Medical Center,
Oh,
where
wonderful.
we are having a new office that we designed particularly for the needs of the bariatric patients, with more comfortable seating,
nice.
special conference rooms for giving them privacy when they are having the conferences. It will be very nice.
That is wonderful. Yeah, that's a great campus over there. Yeah, great. So that's absolutely wonderful information. Explain to me. There's been some complications with some technology out there. Can you share that? I think that I had heard about the lap band that seemed to be popular for a little while. What is happening with that?
Yeah, there are a couple of issues right now being discussed. The lap band. Let's talk about the lap band. The lap band was very popular about 10, 15 years ago. The initial studies on the lap band came out of Europe, and it showed that it had similar results to having a gastric bypass. But what happened is that over time, those results, those numbers went away, and it became obvious that it wasn't nearly as good as the gastric bypass, but mostly patients started developing complications. They started to have chronic vomiting and chronic pain and that kind of complications. So the lap band is still being done, but it decreased in popularity.
Okay.
At some point, the lap band was 40 to 45% of the cases done in the United States. Nowadays, it's less than 4%.
Wow.
So it's going away. Very few bariatric surgeons still offer the lap band. A lot of us are doing a lot of removals of lap bands and conversions to sleeve or gastric bypasses.
I see. So in case you end up having difficulty or any problems after you've had this lap band surgery, please give Dr. Fernando Bayron a telephone call, because he happens to be one of the experts in dealing with these various complications, and he can help you. Now, if you don't have the ability of writing down Dr. Bayron's telephone number right now, you can call Maddie at All County Healthcare. That telephone number is 888-717-7170. Ask for Maddie, and she can put you in touch with a doctor. The other thing also, if there's anybody that's listening out there and would like to have their questions answered by Dr. Bayron, please give us a call here at 888-565-1470. We would love to hear from you. We'll answer any kind of questions that you might have concerning the bariatric surgery. What are some of the other complications that you've been running into?
Well, luckily I haven't run into those, but there was a report last week that came out on the news on the new procedure that is available that is called the intragastric balloon.
Okay.
The intragastric balloon is a procedure we have discussed here before. It's a non-invasive procedure where we place a balloon inside of the stomach, and that allows for patients to feel full all the time and not eat. It's not indicated for the same patients. It's indicated for the patients that are just short of meeting criteria for bariatric surgery.
Oh, okay.
And it's very simple. However, there came a report last week on the news saying that over the last year, there were 6 or 7 deaths associated to the time period, not to the procedure, to the time period following the placement of balloons. 6 or 7 patients died in the following month after having the balloon.
Wow.
And that's on the news, and that's something that we need to be aware of. But as I said in an interview I had last week, first of all, we can never underscore the risk of doing any procedure.
Right.
And in this particular report, as I read it, the problem is that they didn't specify the reasons for those deaths. And we will need to look further into that and know, because the I believe it was almost 400 or 350,000 patients. So 7 deaths in 300 or 400,000 people in a group of patients that we know that are that can be involved having diabetes and high blood pressure could well be related to their original condition.
You're right.
So we don't know that. So at this moment, I'm not saying that we cannot do that procedure. I think that we need to look further into it and be aware that there are risks involved in any procedure.
Yes, yes. So, yeah, that's very, very well said, because you don't really know what the reasons are underneath that.
Yes.
And it could very well be, a complication. Maybe they weren't taking their medication correctly, or something of that nature.
Yes.
Okay, very interesting. Okay. Now, you're also a general surgeon.
Yes,
so
I am.
you do a lot of the surgeries up and down the whole belly. And one of them in particular that we were speaking about were hernias.
Yes.
Can you enlighten us about hernias?
Yeah, hernias is a surgery I really like. I enjoy doing. Well, hernias, there are many different kind of hernias. The most common are the inguinals, the ones that happen in the groin.
Okay. Yes, I'm familiar. Yeah, right. Yes.
And they're very painful, and they
Yes.
can get very complicated if they involve the intestines. They can require emergency surgery. They're associated many times with heavy lifting. So people that works and their work involve heavy lifting are prone to have them.
Oh, okay.
And nowadays we have a robotic procedure for fixing them that is also, it's a 20-minute procedure. Patients go home immediately after the surgery. Swelling is reduced by, there's almost no swelling, and pain is very little, and patients are just excited and happy
You're not kidding, yes.
to see them.
Yeah.
This is a surgery that 20 years ago when I was training, patients would spend 1 week in the hospital after the surgery.
Well, I do have to say that my youngest daughter, when she was born premature. And after 4 or 5 months, she ended up with double hernias.
Yes.
And I understand how, and that was almost 41 years ago. So, things have changed drastically since that point. She had to be in the hospital for quite some time, and even one of her ovaries had popped into the hernia.
And the other thing about the robotic and laparoscopic procedures for hernias, that in the past when we used to do these big surgeries, fix the hernias with stitch, patients would spend 1 week in the hospital, and still the chance of those hernias coming back was like 50%. Half of the time, patients will have the hernia again a few years later. Now with the robot and with laparoscopy, that chance has dropped to 1 to 2%. So now we're not only causing less pain and swelling, we're sending people back to work earlier, and we're fixing them better because they're not coming back.
That's amazing. Now, didn't they used to have a mesh or something that they would put over that? Is that still?
We use meshes, and that's another common question, and we could do a whole show on that because people keep telling me, what about the mesh? Meshes are bad, they're on TV, people are having broken meshes.
We hear a little bit about that, yes.
Yeah, well, every day I get 2 or 3 calls about that. The truth is that meshes today are very safe. The meshes they refer to on TV are not really the meshes we use to fix hernias. I've used many different kind of meshes, and we've never had any significant not any complications. But there are the ones that reinforce the natural tissues and allow us to give patients that 1% chance of not having complications in the future. So meshes are very safe in inguinal and general surgery hernias, and there's no reason to be concerned about
Oh,
them.
that's wonderful. That's great news because you get kind of nervous when you hear the announcements on TV, if you have mesh, please call this number. So that's great news.
Yeah.
That's great news. What else about the hernias? Now, you were talking about the lower hernias in the groin area.
Well,
what other hernias do you end up working with?
Well, the second most common hernia we do is the umbilical hernias. Those are very common. Also, people, most of the time, they're born with them, or also in jobs that require a physical heavy lifting. Also, in pregnant women develop hernias, and sometimes they don't get better after surgery. So we can fix them also with the robot, and it's also a 25-minute procedure, and patients go home the same day. For some reason, it's a smaller hernia than the inguinal, but it hurts a little bit more after the repair, but still is less than when we do them open. And in addition to that, I like doing more complicated hernias, which I can do robotically or open, depending on the degree of complications. And there we're talking about hernias that happens as a result of other surgeries. We call those incisional hernias. And one thing I enjoy doing is fixing hernias that have failed, people that recurs with the hernias, because then those ones require procedures that are very complex, that we call mostly abdominal wall reconstructions.
Oh, okay.
And they're very complex, and that's an area that I enjoy a lot doing, either robotically or on an open fashion.
Okay. So if you happen to have any of these issues that you might be dealing with, please give Dr. Fernando I'm sorry.
Bayron.
Bayron. There we go. Sorry. Please give him a call. He can be reached at
954-472-1322.
Okay, that sounds wonderful. Anything else that you can share with us that you see out there?
Well, talking about hernias, we can talk a little bit. We spoke a little bit earlier about hiatal hernias and reflux. That is another surgery for which the robot seems to have been designed for that. And that is different. That is not a hernia that comes out of the body. It's a hernia where the stomach, the esophagus slides into the chest. And it causes reflux, it causes regurgitation. Patients cannot lay flat on bed and they cannot sleep. So patients are very uncomfortable when they have them. In the past, the approach to do them open was a very, very big surgery, very bad surgery. So gastroenterologists and patients, they kind of didn't want to deal with the surgery. They didn't want to refer patients, or patients didn't want to have surgery. Now with the robotic approach, it's much simpler. It's 1 hour surgery. Patients spend one night and they do really, really well. They are back to regular activity within 4 or 5 days, and they have really, really results. And that surgery is very, I feel great when I do them, because these patients have been unable to sleep flat in years, and they get fixed immediately.
That is incredible. Yes, I know exactly what you mean.
They wake up from surgery. It's so gratifying when I go and see a patient the following morning and they tell me, "Doctor, for first time in 10 years, I've been able to have a good night's sleep."
Oh, my goodness. So please give Dr. Bayron a call. And if you're dealing with that type of issue, please give him a call. Make an appointment. I've got to tell you, yes, I had a very, very dear friend, and he dealt with that as well for years. And he couldn't even lay down in a bed. He had to buy a special bed that would sit straight up so that he could sleep. So, please give Dr. Bayron a call, by all means.
Yeah, it's great.
It is great. Well, thank you so much for being on the show. I so appreciate it. And I've got to tell you, he's got such a warm personality, great bedside manner. He's such a great guy. Well, don't leave. We've got another fabulous doctor that's coming on right after this, but we're going to go to a commercial. So we'll see you in a moment.
County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Yeah, Luis Alvarez, Spanish.
I gotcha. Hi, welcome back to You and Your Doctor, where we're teaching you how to live a healthier and longer life. I'm Lorena Anderson. I'm your host for tonight, and we've got another fabulous doctor on. I would like to introduce Dr. Luis Alvarez. So welcome. Thank you for coming on the show tonight. I truly do appreciate it, because I know how busy all you doctors are. So, and I really do appreciate the fact that you would come and help educate us. So would you please tell us a little bit about yourself?
Well, my name is Luis Alvarez, and I moved to Boca Raton about 10 years ago. Okay. And I opened up a clinic with my sister.
Oh,
so
okay.
We're affiliated with West Boca Medical Center, and I treat from birth to grave, basically. So every age. We have a lot of Medicare and Medicaid out here in Boca.
Okay.
And we also treat, young families, and we try to take care of the whole family.
Okay. So you're very holistic then.
Yeah,
you
say
take in
that.
everybody.
Exactly.
I love that. It's a real family affair, it sounds like.
Yes, you're right. Exactly. Yes.
So tell us what your specialty is.
Well, I am family medicine, so we treat everybody. People come in. We do immigration, physicals. That's government, and we see families. I see a lot of Medicare because I'm near Century Village.
Okay.
So we see that. We take care HMOs, different plans. We have a good staff, very friendly. I used to do home visits. I don't do so many anymore, but we try to just take care of everybody.
It's
been
wonderful.
pretty good. We're pretty busy, and we do have an office mascot, a dog that's there.
I love it.
So I checked with the health department. They said it was okay, and as long as we don't serve food. So we don't serve food.
No food?
No food, sorry.
You
we have
serve
cookies.
dogs,
we have
but
cookies
okay, cookies,
in the
that's
front.
good.
But people love the dog. It has a calming effect.
Yeah, absolutely. What kind of dog is
it? A Samoyed named Nico.
Oh, wow.
So he's sort of a fluffy dog, but he is hypoallergenic, supposedly.
Yeah, that's wonderful.
You wouldn't think that if you saw him because he's so big and fluffy.
Yeah,
but,
big and white, huh?
Exactly.
Oh, yes, I'm very familiar.
But people love him, so it's sort of, some people say, I didn't come here to see you, Dr. Alvarez. I came here to see the dog. I'm like, okay. So.
Well, something that's a great little extra. Also, if you're running a little late, they don't mind so much because they're busy, playing with the dog and loving up the dog.
Love the dog,
Yes,
so it's nice. It's nice.
So it's you and your sister, both of you are in practice together?
Exactly.
And do you see anything common, anything that shows up on a consistent basis that you're working with?
Well, I don't know. It's... things are changing in medicine. So with me anyway, everything's electronic now. We send our medicines through the computer to your pharmacy, whether it be Publix or, CVS or Walgreens. But I guess the main thing is exercise. You know, I don't see people getting enough exercise lately. We have a lot of people with hypertension, diabetes, you know, high cholesterol, and they need to manage those things. And people often, I hear a lot, I feel fine. Well, really? But your cholesterol's out of control.
Yeah.
You know, and your diabetes, you got diabetes. Well, I feel fine.
I feel fine, but I'm a good 30 pounds overweight.
Or 50.
Oh, yeah, or 50, yes.
But that happens a lot. So people, you know, it's important to get a yearly checkup, to see your doctor, get your blood drawn once a year. And then, you know, preventative care, you know, mammograms, pap smears, blood draws, those are all important.
Yes, absolutely.
We do the paps here. We don't have x-rays at the office. So we send, you know, bone mineral densities we send out and colonoscopies we send out, but we do draw the blood, EKGs. We do things in-house too. So.
I love that. I love that. So I'm constantly saying, you know, you've got to get up, you've got to exercise, watch what you're eating, cut down on the fats,
exactly,
you know, and really start motivating yourself so that you have better quality of life. Because with better quality of life, you have quantity of life.
Exactly, that's true. You know, a lot of people they think I'm young or I'm healthy or I exercise, everything's okay. But I might get, you know, a 40-year-old man who's 100 pounds overweight. I'm thinking, oh God, this guy's a train wreck. You know, his cholesterol's got to be bad, is maybe diabetic, and everything's perfect. You know, he's great. Then I get like a 32-year-old woman with 2 or 3 little kids. She's been jogging, she got her hair in a ponytail, and her cholesterol's out of control. She's diabetic, she doesn't know. So you can't really judge a book by its cover.
Exactly.
You know, people need to come in and be seen. We know we do flu shots. We do, you know, we try to do everything, you know, just sort of well-rounded.
Yes.
We try.
But I remember, you know, back when I was growing up, I ended up having a family doctor as well. And,
exactly.
And I have got to tell you, and he would do house calls. We're talking a long time ago. But it was amazing because he followed me all the way through, and he understood my whole entire medical history.
Right.
It wasn't as if, you know, my medical history was out at 15 different doctors.
Well, that's how it is now.
I know,
I get a lot of people, patients from New York, for example, and they're like, well, I have my cardiologist, I have my endocrinologist, and I have my OBGYN, I have this. You know, where I would train in Kansas, I come from Kansas City, and I went to the University of Kansas, and that's where I did my residency. But
I could kind of feel a little Midwestern there.
Oh, really? And I lived in Texas for a while.
Oh, okay. Well, I'm from Chicago, so that's why, you know.
Exactly.
There's just a warmth.
You know, it's a nice thing to have a doctor that knows what's going on overall.
Yes.
Because if you have so many different doctors, it's hard to stay caught up with every different specialist and everything like that. And, we need the records from your endocrinologist or your cardiologist.
Yeah. And what medications are you on?
Exactly.
And sometimes, you know, one doctor will prescribe this particular medication, but doesn't know that you're taking these medications
That's
as
true
well.
Too.
And you can have a bad reaction. So
that's true. That's true.
You know, you're so valuable. You're just so valuable because you're so well-rounded. As I said, you know, you're holistic.
Right.
You watch an individual, as you said, from birth to death, but everything's coherent. You know, you can follow that medical history.
Right. That's important to know.
And what's really nice too is that, you know, you accept not only the Medicare but Medicaid as well.
Exactly.
And that's a rarity these days.
Yeah, that's true.
You know, where you have a real family doctor, somebody who really cares about you and willing to accept Medicaid.
Right.
So that's wonderful.
And I'll get a lot of patients come in and see me. Well, you know, we have 2 kids and we're looking for a pediatrician. So that sort of helps having my sister there because she sees kids. So it sort of goes back and forth.
What's your sister's name, by the way?
Dr. Sandra Alvarez.
Okay, Dr. Sandra Alvarez and Dr. Luis Alvarez. And what is your telephone number and your address so people can get a hold of you?
It's the phone number is 561-477-2862.
Now a little slower.
Oh, sorry.
Just so the audience can take down the number.
Right. It's 561-477-2862.
Okay, great.
And the address is 19801 Hampton Drive, Boca Raton, Florida, 33434. We're sort of tucked away just south of, we're north of Glades Road off 441.
Oh, okay. Okay, great.
Yeah.
Excellent. Beautiful. And how long have you been there?
10 years.
Wow.
It's sort of hidden back there. There's a gas station. We're behind there's a Mama's Pizza. Some people know that location.
Uh-oh.
But, we need to
We
watch
were
our
just
pizza.
talking about diets, right?
Exactly. But, no, we've been there for about 10 years, and things are going good. we like it there, and the patients can find us lots of parking, handicap access, of course.
That's fabulous.
And we're probably 3 lights down the road from West Boca. So,
that's great.
Yeah.
So nice and convenient. So if you happen to have any questions whatsoever for Dr. Alvarez, you can call us here at 888-565-1470, 1470, and we'd love to hear from you. In case you weren't able to be next to a telephone or you can't call in, you can always call All County Healthcare. The telephone number there is 888-717-7170. Ask for Maddie, and she can put you in touch with a doctor. And the other thing, too, is that in case you aren't able to see the whole show tonight, we do have it archived on the website, allcountyhealthcare.com. So you can go there, and you can also see all the other shows that we've done in the past year with various doctors. So, by all means, if you've got any questions for Dr. Alvarez, just give us a call. So tell us a little bit more about your family practice and what inspired you.
Well, my father's a physician, so growing up, I'd go to the hospitals with him, doing rounds, and I sort of liked family medicine because it's a little bit of everything. I'm not just I have a sister who's an ophthalmologist in Texas, so she's looking at eyes all day long, which is great. But I sort of wanted to do a little bit different, more like my dad. That you get the variation, different things coming in. I might get someone with hypertension or a sore throat, for example, or maybe they hurt themselves or different things like that. So it's sort of you get something different all the time, and that makes it a little bit exciting.
Yes.
We try to drawing blood, reviewing results, just trying to help people live a better life and a healthy life.
I gotcha. So what are some of the screening tests that you recommend for people who just want to be on top of their health?
Well, overall, the blood draws, in my opinion, blood draws are very important. So, during a yearly physical, we do the blood. So we check your cholesterol, we check your triglycerides, see how that's going. Chemistry will show us, for example, your liver function, kidney function, that's important.
Yes.
Also, the basic chemistry, your sugar level. If someone's diabetic, we do an A1C, which will tell us how their average sugars are over the last 3 months. Of course, for women, getting mammograms yearly are important. Colonoscopies after 65, some do start earlier. Pap smears, there's a lot of preventative medicine that's out there, and we try to do the most important. Also, bone mineral density is important.
Yes. See, I had a colonoscopy at 50, and that's what they were recommending
they
at that time.
recommend them now at 50.
At 50,
to start there. And then depending on...
And the bone density as well.
Exactly, and they do that every other year usually. So that's important to get those done and stay on top of your health, too.
Yes.
I can tell you what to do, but ultimately it's up to the patient to get out there and do it.
Do I know? Yes, absolutely.
Yeah.
Absolutely. What are some of the other things that you recommend people, not only doing some exercise. I know, especially for our seniors, it's really important to get a good exercise in. A lot of the gyms that I know of, they have a swimming pool as well. So they have, a little aqua exercising that they can do.
Yeah, that's true. Some of the low impact exercises are good. Even just walking. I know there's walking groups. My father's in a walking group. And in the summertime, they go to the mall. So you'd be surprised. You go to the Boca Mall before most of the stores open. There's like the coffee shop and the pavilions open. But people are just walking all over the mall because you're not going to see them walking in 89-degree heat and humidity. But you can get exercise at the mall. Swimming is low impact. So people, my knee hurts or my back hurts. Well, getting in a pool and just swimming around, that's some kind of exercise that would be good.
Yeah, absolutely.
You don't have to get on a treadmill. Just even little exercise is healthy and good for you.
Absolutely. So in case you can't get out or you're either in a condo or it's too hot out there, absolutely. Check into the Boca Mall.
Yeah, because it's open all the time.
It is.
They have resting places, have sofas, couches, places to sit down. So
that's fabulous.
It's an option.
Yeah, it's a great option. Absolutely. Oh, I was sitting there thinking, well, in case they don't drive, you can Uber.
Yeah, that's true. That's true.
Just do Uber.
Right.
It happens to be one of, and it can't be that expensive anyhow. But just to be able to get out, and not only that, but socialization is so important as well.
Yeah, that's true.
Because they motivate each other.
Exactly.
And not only that, but you meet somebody new, and then you have someone to talk to. And I got to tell you, going around the mall a couple of times then becomes really easy.
Exactly.
Because you're not thinking about it.
That's true.
So I usually tell my clients, I said, whatever you do, you got to get exercise in, but I don't want you to think about it. And they're looking at me like I'm crazy. I said, once you think about it, you talk yourself out of it. No more thinking.
Exactly.
Just do.
That's true.
Yes. So what other advice do you have for our audience?
There's once you get in and get established with a doctor, then you have that rapport.
Yeah.
So it's important to do that. A lot of people refuse to go to a doctor until something happens. And by then, it's not that it's too late, but, it's good to stay on top of things from the get-go. So I have patients all the time. I haven't seen a doctor in 10 years, stuff like that. They feel good, so they don't think there's anything wrong. But, there's other things that creep up over time. So it is important to get in there and see any doctor. Yes. But, usually general doctor, I'm not trying to plug myself. But
plug yourself.
You get
it's
in,
okay.
you see a doctor. Now, if needed, I will send you out. If you need to see a cardiologist, if you have an abnormal EKG or something like that, or if you have, uncontrolled diabetes, and I can manage a lot of these things, but there are some things that need to be sent out. Right. So, at West Boca, we're connected to a lot of different groups, different doctors. So, I would be the one who would get you to the doctor that you need to see. For example, little things like dentistry, getting regular dental checkups is important, because down the road, you don't want to deal with that.
Right.
So little things like regular brushing your teeth, ophthalmology visits, getting your eyes checked is important. And a lot of people don't do that.
Well, and I've heard this before, though. If you've got any infection in your mouth, that can also play havoc with your whole system.
Well, your valves in your heart, can affect your heart, different things. So they say dental, hygiene is so important. A lot of people bypass that.
Oh, no.
So they need to take care. They need to take care of that.
And you help them with that too, don't you?
Well, I mean, in a way.
Well, because you're motivating them to take really good care of themselves.
That's true.
Yeah.
And vision too.
Vision too. Absolutely.
Yeah, cataracts are big, especially in the population here in South Florida.
That's right. So, and I've heard some, detached retinas.
Yeah, that can happen. That's spontaneous,
Yeah, 3 of my friends ended up having that.
That's true. Wow.
Yeah, I know. I'm like, what have you been doing?
I don't know.
So you were inspired by your father.
Right.
I've heard, that's usually one of my common questions, because I like to find out where your passion was ignited. And I do find that either it's in the family, or there's been a family issue.
Yeah, that's true too.
Yeah, where like their father had horrible diabetes and overweight, and then this son ended up deciding that he was going to go into help, or the son ended up having huge migraines and then decided to go into chiropractic.
Yeah, that's true.
So I love to find out, but I've got to tell you, Dr. Alvarez has got such a warm bedside manner. Oh. And a great smile as well. And I get the feeling, such compassion for what you do. And I think that is such a key ingredient, because you need somebody that can connect on that emotional
level. That is true.
level.
That is very important. You can go to the best doctor in the world, and if they don't have a personality and you can't relate or talk to them, it's not going to be that effective. I mean, I'm sort of down to earth. So my office is that way. We treat people. People usually have a good experience at my office. So, and that's what we want. You have to be able to connect to that doctor. The person who you're telling, your health problems to, your personal issues to.
Right.
If you don't have a connection, you're not going to have that much.
You're right. You're right, because that's their life.
Exactly.
And half of, I think the majority of trying to help an individual is by hearing what they have to say.
Exactly.
Because they're trying to describe to you what is going on and why, and they have no clue why it's going on.
I have a lot of patients say, I don't want you to yell at me. I'm like, I'm never going to yell at you. I get that a lot. Patients, my cardiologist yelled at me because my blood pressure is too high or my diabetes wasn't controlled. I'm not going to yell at you. I'm going to try to facilitate or motivate you to do what you need to do. But ultimately, it's a patient's choices and decisions that they make. I just try to direct them in the right way,
Absolutely.
with, being able to talk. And I speak Spanish too. So one of my staff speaks French.
I've got to tell you, I couldn't tell. There's no accent at all. So it's
I speak Spanish, so I get a lot of patients to pick me because of my name. But, I speak English, obviously, and Spanish, too. So we have Ben speaks French. Gail is our receptionist up front, and she's very kind, and she, we help people. And we also have Nikki that works there. Tiffany's part-time. She's like a student.
Okay.
So, we try, we're rounded out there.
It just, it gives me a sense of a down-home, kind of a farm community doctor's office.
Yeah.
Where you could bring in your cow along with you if you were.
People bring their dogs all the time. Not all the time. Every now and then. But we don't object to that. So.
And I'm sure your little friend, what's his name? Nico. I bet he loves a little bit of company every now and then.
He gets a lot of attention.
Yes.
People love him. So.
I love that. Very, very down home. So how do they get a hold of you again, please?
So my phone number is 561-477-2862. And we're located we're off 441, just north of Glades. The street there is Kimberly. And we're right near Century Village, so.
Okay. Great. I was just reading a few of your comments, and one was Nico the dog, the mascot.
Nico the dog. That's right.
Come in and see Nico.
Exactly, and people do.
I love
people
it.
have walked Nico while they're waiting to see me.
Oh my God.
So I know it's a little crazy, but we do that too.
I love that. So what other things can you share with us? I mean, I can tell what makes you special, but what do you believe makes you special?
That's a good one.
I know.
That's a good question. I don't know. I just have this, I guess I have some compassion for people. I want to help out. If I see something going on that I can help, I do. So I guess that's what led me into medicine is, not the humanity thing, but it is. It's like, I want to help people. So if there's something I can do to help them, I try to do that.
Yeah.
And health is a big one.
Health really is the only one, to be honest with you.
Probably.
And you know what they say, you can't buy health.
No, that's true.
So
you gotta, I try to motivate people in that way. I try to get them to, working on their diet, working on exercise, eating healthy. I'm not going to kill you if you had a piece of pizza or if you had a bagel with cream cheese and maybe we're trying to cut down on carbs. But, there's ways to motivate people, not by yelling and screaming at them.
Yeah, I've got to tell you, I don't think I've ever seen it work. Yelling and screaming at somebody.
I don't think but amazingly, I hear that all the time.
Oh, my goodness.
And people get busy. We get busy at my office, and we have 3 lines, but sometimes, people might have to call more than once. But we try to take care of it. People leave a message, we call them back. People are surprised. I'll call them myself on weekends, or something, because we don't get everything, they may not come in.
You call the patient back?
I have. Unfortunately, they get my phone number, but it's not a problem. All the office phone calls go to my personal cell phone after hours and on weekends.
Okay.
Now, I don't answer the phone all the time, but if I see a message or something, I'll listen to it, and, if I need to call someone back, I will.
Wow.
Yeah.
That is very special, though.
Well, we try.
Yeah. You know what Yoda says? You do not do. There is no try.
Yeah, that's true.
Yes.
That's
So
right.
you do offer an amazing service. And I just absolutely love the fact that your bedside manner is so warm and so caring, and that you do care about people. It must be awful rewarding.
Well, it is rewarding. There's always good and bad, but in general, we try to get the good going and, that kind of feeling, I guess you could say.
Yeah, absolutely. Absolutely. Because that's what they come back for. They come back for the feeling.
Right. That's true.
A lot of times, with other individuals or maybe other doctors, they don't quite have that connection, and that connection is invaluable.
That's true. I mean, you have to, like I said earlier, you have to have a connection with your patient.
Yes.
If not, what's it for? You need to be able to relate to someone. You need to be able to have that conversation, and talk about things. And I think that we are pretty successful at doing that.
I would think so, yes. And one of the other really wonderful things, I just want to reiterate this, is the ability of having one doctor follow your lifespan. So you can come in, you can talk with the doctor, you can give Dr. Alvarez all your information and everything, and then it stays with him. And then when you come back over and over again, it's not as if you're seeing another stranger. He knows your life history. He understands where you've been, what you've gone through, and it's documented, and he can go from there. He doesn't have to go, trying to figure anything out.
Right, exactly. Because, once you get to know, that's the whole thing about family medicine. You're establishing, a friendship, a rapport.
A relationship.
Exactly.
Yes.
So it's not like somebody comes in. When they come in a few times, I know their history. So it's not like I have to ask them now, did you have your tonsils out or not? Or whatever.
Have you had any surgeries?
Yeah, exactly. So, we do that the first visit, but then after that, they're established and we move from there.
Yeah.
So we can track them over time. We see how their sugars have been, how their blood pressure. A lot of people come in just once or twice a year and that's it. Some people
isn't it great that that's all they have to come in?
Exactly.
Yes.
But if you have other health issues that you need to be followed more closely, then we do that too.
Yeah, that's very impressive.
We should be getting our flu shot in pretty soon too. So
flu shot, guys.
My dad, who is also a doctor, he would never get the flu shot. And then finally, when he got the flu so bad, he thought he was going to die. Guess what? Flu shot every year.
Oh my goodness.
So sometimes it takes that. I get a lot of patients that, for example, don't want the flu shot or don't want to get a pneumonia shot. And it's recommended, and until you get sick, you may not want to do it. But once you do, then you're there.
Gotcha. And so do you see a lot of pneumonia down here?
We do.
Do you?
Yeah, and there's still a lot of smokers, and they're more prone to get it. But, it's recommended once after 65.
Okay.
But until then, you need to get it. So it's not a bad thing to do if you're into preventative medicine.
Yes.
Which is what I do. So
exactly. Exactly. Yes. Absolutely.
Yeah.
Well, it has been such a pleasure to have you on. I really do appreciate it. I love your effervescent personality.
Thank you.
And the fact that you really do care about people. And please, whatever you do, my dear audience, if you're just give Dr. Alvarez a call and do a physical with him so that he can watch and see whether or not there's anything that you might be dealing with that you're not sure you're dealing with. And many times, he might be able to uncover something before it really becomes a problem or a crisis for you. So I really do appreciate the fact that you came in, you shared your knowledge and your education with us, and we don't get many family doctors on the show, so I really do appreciate you stopping in.
Well, thank you very much. It's been a pleasure being here.
It has been our pleasure to have you here. So. This is Lorena Anderson. We are here every Tuesday between the hours of 6 and 7. We are filming live, or you can hear us on the radio, 1470 AM or 95.3 FM. In case there are any doctors out there that would like to be part of our show, please give us a call at 888-565-1470, and we'll see what we can do. Thank you again for being with us, and we'll see you next week.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff,